Okay, Assalamualaikum and good morning, everyone. Uh, this is just to explain about OBE document in view of our curriculum review exercise for Bachelor of Dental Surgery program. However, this OBE document also apply to any other programs in UiTM for our faculty. However, some of the content may be different. Okay, so today I'm showing the OBE document that is pertinent for our Bachelor of Dental Surgery program. Okay, and my briefing today will refer to several documents, and these documents will be available for you to download via your resource person for every code. Okay, so they would be able to share with you this OBE document. So in general, we have 8 types of OBE document for every course. So every course in the program will have one set of OBE document, which is shown on the screen right now. So one set contains of 8 types of document. Okay, 8 types of document. And I also has prepared a short statement about the OBE document in the same folder, which is this one on the screen right now. So I have explained a little bit what to do, or what is what is needed for every for every document. So maybe from time to time, if I find something that is important, I probably will just add it over here so everybody can view it later on. Okay. So so this document, if you want to fill it up, you have to have the content already, so you can fill up very easy. However, before we go to this what we call this briefing for the OBE document templates, I would like to reiterate, for those of you who are new to academia, maybe you can have a look at other documents as well, to just to make yourself familiarized with OBE and others. Okay, so first of all, for UiTM, we have a system. It's called AIMS, AIMS. AIMS is a curriculum online system for UiTM. So supposedly all courses registered in every single programs in UiTM will have their record in AIMS. And these aims need to be updated whenever it is changed. Okay, whenever it is changed via curriculum review or any minor review that that is happening. So every who has access to aims, it is the resource person for every code that has access. So once you enter the data for aims, the deputy dean in academic will have a look and approve. So once it is approved, aims will have what we call this data integration with the student transcript. Okay, with the student transcript whenever they graduate later on, and also with the other systems. So this is very important for you to have updated data in AIMS. For your information, I have another video for AIMS that I can share with you later on. Okay, so this AIMS is the system for our use in terms of curriculum management. Okay, and then the next one is the COPA, or Code of Practice for Program Accreditation for Bachelor of Dental Surgery. So we have COPA for postgraduate program, we have COPA for diploma program, we have COPA for PhD program, and also doctor in programs. Okay, so this one I'm showing you a website or a web page pertinent to the COPA documents that is available in Malaysian Dental Council website. So if you Google MDC COPA BDS, you will find this, and then you can refer to these what we call this, to these regulations and standards. Okay, and for your information, in a few months more, I think they will update some of the content, especially for the COPA content. So some might change, especially the appendices will change a little bit. So our recent curriculum review that we have a workshop in Malacca last time, we have also tailored to the new one actually. Okay, the one in the website is a bit is a current one, but will be updated very soon. So stay tuned for that updates later. Okay, so anyway, but they would have the same framework. It's only the some of the minor details will have changes. Okay, excuse me. So from this COPA, you can see the SLT guideline, how you calculate the SLT. And then I think most of you are well versed with the competencies. So these are the competencies list for the BDS program. And then this is the transfer credit. We are not so, what we call this, we are not using this so much because we do not really accept transfer credit from other university. We do have it, but very seldom. And then we have guideline for TPC, temporary practicing certificate for foreigners. And then this is the full-time equivalent calculation for lecturers who are doing part-time and full-time. And then this is the MCE for our requirement. Okay, so we are going to refer much of these to this document when we are preparing our OBE document. Okay, the next one is the MQF 2.0, which is the Malaysian Qualification Framework, second edition. You need to understand this one first before you filling up OBE, because we are going to use this one a lot. Okay, so if you click this Malaysian Qualification Framework MQF second edition 2024, the PDF, you will get this one. Okay, so this is the MQF to 2024, and what is the most important in here is the program learning outcomes that you will follow. Our program also following the same thing here. So if you go to certain pages, it will explain to you what is MQR, what is MQF, okay, and then what is the level. So every single program has their own mapping, and then this mapping actually following the MQF second edition. Okay, so if you take your time to read some of these, it probably will be very beneficial for you to understand the whole concept of academia and also program management. So this is the level of education, levels and qualification you can refer to. And then these are the level descriptors that we are following right now. But the learning outcomes that we are using is actually this one. Okay, so we will be mapping our curriculum or our learning outcome towards this learning outcome. This is the basic framework of the learning outcome of each program. Okay, so you will see what I mean by this later on when we are filling up the OBE document. Okay, so these are the documents that you need to be well versed. Okay, let's go to the documents. So there are 8 documents again. Okay, so the first one is course information. The second one is the CAP, the course assessment plan. And then we have local taxonomy, the learning outcome, course outcome taxonomy. So this is just a mapping to the Bloom's taxonomy. And then we have JSU. Now we have 2 JSU instead of 1. I think it will be more clear when I explain to you later. So the first JSU is the one that we have in the faculty. Okay, and then the new one is actually I think some of you have been using this. So The next one is JSU Blueprint. This one we can download from the UiTM, but I have downloaded it for you for it's easier. So this is actually a blueprint. So it is available in Excel file. I will explain to you later on what are the difference between this and the Word format. And then we have Koloki Mohi. This is quite important also for you to understand. This is course outcome mapped to the learning outcome and also KI. KI is actually in Malay, Kemahiran Insania or soft skills based on the Ministry of Higher Education. It has to do a lot with our assessment later on. Okay, so you have to make sure you understand the this mapping. Okay, the next one is another sort of like a duplication, but it is more definitive. So this is Mohi KI. KI again is the Kemahiran Insania, which is the soft skills, okay, from Ministry of Higher Education. And then the last one is the SLT, Student Learning Time. This one we need to have a better calculation these days, because I think there are so many mistakes in the past, including my course. So we need to have it corrected when we do this curriculum revision. Okay, so this one also you can refer to the COPA BDS that I have shown you earlier, how to calculate for every teaching methods. Okay, for every teaching methods. Okay, let's go to the first one, which is the course info. So this is the new course info template. Fill up the course code, course name, MQF level, the one that I just opened to you for the MQF level. So this is for the degree level. So you can find out what is the level for degree. We have 1 to 8. 8 is our PhD, 7 is masters, and 6 is degree. Okay, so the credit equivalent. So what it means by credit equivalent is the total student learning time after you add face-to-face and non-face-to-face from the SLT later on, you will get the total number, which is we call student learning time. So for example, if you get 4,000 hours, okay, 4,000 hours here, the credit equivalent will be 4,000 divided by 40. Okay, 4,000 divide by 40, so it's 100 credit hours. Normally for credit equivalent in our in dentistry and in medicine, we divide it by 40. So 1 credit hour equivalent to 40 SLT hours. Okay, 40. And then later on you fill out the semester. So from which semester to which semester, because normally in every universities, in every course or program, every course code that you listed out here only lasts for 1 semester. They don't go beyond 1 semester. But in UiTM and some of other universities for dentistry and medical, the course actually extend beyond 1 semester. So for us, maybe we have up to 10 semesters even. Okay, so you can fill up 1 to 10 here. So some of you will start in semester 4 until semester 6, so 4 to 6. Apparently for a prerequisite, it means they have to take another course prior to this course. Okay, so if you have none, just put none. Normally for prerequisite in our curriculum, we just put none here. But if you want to put something like they have to pass the, for example, restorative 1 first, and then only they can take restorative 2, that one is okay, right? And then course learning outcome is the one that your RP has figured out ataupun your department has discussed to come up with the course learning outcomes. For course learning outcome, it has to be not more than 5. Okay, not more than 5. And I do believe your RP probably has the finalized CLO. If not yet, please do discuss with the department or anyone in the department to come up with a course learning outcome. It has to be approved by the department, and then later on to the curriculum review committee, and then later on the curriculum committee, and so on. Okay, and then here, what I put here is the cognitive level or any domain that pertinent to the learning outcome. So this is C4 means cognitive level 4. Cognitive level 4 means analysis. And then you also need to map to the PLO. This is the one that I showed you from the MQF 2.0. But our program, this is PLO to our program. Okay, so our program also tailored to the MQF 2.0. So whatever MQF 2.0's number, it actually correlates to our program learning outcome too. So it's easier for us. Okay. Some other programs, they don't follow that. But for us, we do follow the MQF 2.0. So we have 11 PLOs for our program for PDS. So maybe you will map to different PLOs. So one CLO should be mapped to one PLO. That's the most ideal, because if you map to more than one PLO, it will be problematic when you are doing the CQI, CDL, you are doing the mapping later on. Okay, and then for course description, please describe. I think most of you have done this. You can find this in your handbook as well, what you have described about your course. To make it beautiful, use your AI. Okay. For course content, this course content means whatever you teach them in the classroom or in the clinics that have learning outcomes. Okay, so for example, you can be creative about this, but please leave the topics and specific learning outcome. You can delete the block and module if you don't have one, but you can leave the topic. For example, topic here is to understand, for example, describe carries. And then one topic maybe about 1 hour. Okay, 1 hour in SLT for one topic which translate into 1 hour. Usually for specific learning outcome, they will have at least 2. Okay, so average 2 to 3 SLO for 1 hour topic. Average 2 to 3 SLO for 1 hour topic. And the topic here should correlates to your SLT and also should correlate to other documents. So if you have 25 topics throughout the course, you should have 25 topics spelled out in the SLT as well. Okay, and also in your JSU. So it has to correlate to your JSU blueprint, not the JSU Word format, but JSU Excel format. Okay, so it has to correlate. So 25 topics here, 25 topics in SLT, 25 topics in JSU blueprint. Okay, and then for every specific learning outcome, you need to make sure it follows the Bloom's taxonomy. And where you can get the Bloom's taxonomy, to make sure that you have the similar one, go to Bloom's taxonomy here, section 8, taxonomy of educational objective. This is by the Malaysian Dental Council. So please refer to this one. Okay, and then once you get 25 topics, I'm just talking about example here, 25 topics. So if every topic you have 2 SLO, because we assume every topic is 1 hour, so you might have 50 SLO. Okay, 50 SLO. And this topic should address your course learning outcomes. Okay, you might find your topic here is actually meant only for lecture. Okay, but if one of your CLO here is actually have cognitive, not a cognitive, lecture is cognitive, right? So whatever C here is actually presented in lecture or seminar or tutorial, anything not in the practical part. Okay, let's say your number 5 is actually start with the word perform. Okay, so perform is not C4 anymore. It's actually P4 if I'm not mistaken, or P5. I think P5. P5, for example, is P5, is psychomotor instead of cognitive. Okay, so if you have perform here in P5, and then it would probably map to not PLO2 anymore. I think it's PLO3. Okay, this is psychomotor. in our program, PLO3. So it should not shows up in the lecture topics. Maybe you have in preclinical or in other method. So you can just add. The one I prepared here is for lecture, preclinical, seminar. Maybe you can add clinical, you can add anything that you want based on what your course have. Okay. So just fill out the topics, and these all should be cognitive. So if I were to ask you how you map this to the blooms, so everything here is cognitive. But when you go to preclinical, everything here is either psychomotor or affective. But please be aware, if it is affective, for the preclinical, it will actually need to involve human being. Means that they are doing practical among themselves, talking, communicating, because affective is a behavior. So it's not something doing in the sim lab. Okay, so effective normally we map the card either clinical or anything that involve human. Okay, so that is effective. For psychomotor, you can do in preclinical or clinical, and clinical also can have effective because there is human, which is patients. Okay, because we will map to the assessment. Okay, I hope you understand that one. If you don't, please come and ask me your questions. Okay, so these are lecture topics. Preclinical topic you can add C3, C4, C5, C6, whatever you need. Okay, based on your content. Okay, and then just list out the teaching methodology. Teaching methodology here will actually resembles or similar to what you are going to list in the second document, which is CAP. This one, CAP. So whatever the teaching methodology map used in the mapping here should appear here. Okay, and then course assessment here is actually a very concise summary of what you have in JSU Word format. JSU Word format here, you will probably have it here too. So we have summative assessment, and then we have formative assessment. In summative assessment, we have continuous and we have professional examination. Just list out only. You don't have to make it detailed because the detail is in JSU. Formative assessment, if you have. If you don't have, just type NIL, nil. Okay. So formative assessment does not contribute the marks for the exam. Does not contribute the mark for summative. So normally when you do formative, you are just doing some performance check on your students. So the student can get feedback from the formative assessment to improve. But if you are doing an exam or test that has marks that contribute to the final marks of their performance, it will be part of the summative assessment here. Okay. And then the next one is MRE or ECE. I think we have ECE. The new one, the new COPA, I'm not sure if they have ECE only. Correct me if I'm wrong. You can list out all the requirement here. Okay, the new one is we used to have dental competency that only listed out for your course, but I have prepared for you the whole competency that you get from here. From this appendix S22, the competency here, I have copied and put it here. What you need to do instead of last time, you need to list out over here what are the mapping for the competencies. Now you are going to map, just list. For example, this is you need to fill up here prescribed activity and assessment. For example, your course address PLO 1 number 4. Explain the etiology and pathogenesis of systemic conditions and disease processes such as infection, inflammation, disorders, blah, 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 blah. So prescribed activity is actually lecture or seminar or tutorials. Okay, because this is C, right? C2, C, and it has to match with the cognitive. And then for the assessment, because it is cognitive, you have to match with the what we call this, the method for cognitive. Maybe you will do this in NEQ, SCA, OBA, you know, on paper examination. And when you list out here, we know how you map to the required competency for your course. Maybe your course does not address number 1, number 2, and number 3, so you do not fill it out. Okay, you don't fill it out. You just fill out for the one that is pertinent to you. How do you know which one is pertinent to you? Your RP will know exactly which one has been mapped, because we have done mapping for every courses in the past. Okay, so learn that and try to map. Okay, and this prescribed activity and assessment is also should also correlate to the JSU of your course later on. Okay, so I have prepared everything, so you just try to fill out whichever possible. Okay, I'll give you another example. PLO3 is perform, which is psychomotor. Okay, so perform number 30. Let's say you are mapped to the number 30. Perform clinical examination, intraoral radiographic, and other necessary investigation, P5. Okay, so perform is P5, and here prescribed activity here should be clinical. Let's say you put clinical rotation, and then how you assess? Maybe you just assess through the logbook, or you assess through OSCE. Okay, so you just put it there. That is example. All right. Okay, I hope you understand that one. And for the references, the last part of this document, references, put the references. Do not be too ambitious. Just put like 3 to 5 references, the most updated one or the most updated version or edition of the books. You can put journals as well. And you have to mark like 1 star for recommended, 2 star is further readings. Usually when you put 1 star here, the library will ensure they have the book in the library. Okay, when you put 1 star. So we have to submit our references to the library so that they can order for us either ebook or physical book. Okay, so far we have submitted our references every year, you know, so they will update us, update the library books with our references here. Okay, I think that's done for the course info. Any questions? No? So I'm going to move to second one, CAP. So this is course assessment plan and also constructive alignment. For this one, just fill out all the way till here. Okay, and then fill out the course learning outcome that you have come up with. So you might have 1 to 4, or the most is 1 to 5. And then PLO, this is the PLO of the program. So 1, 2, 3, 4, 5. MQF, so if you have, as I mentioned earlier, our PLO is equal to MQF 2.0. So it's easier for us to address that. So if you put PLO number 2 here, MQF will be 2 as well. And then MOHI, I will get you the list of MOHI learning outcomes. I think your RP also have in our folder what is MOHI learning outcome. So this is MOHI learning outcomes. Taxonomy domain is the cognitive, psychomotor, whatever it is. Teaching learning activities, you need to map to the learning activities. Okay, so lecture, seminar. Okay, be careful. If you put perform here, it cannot be lecture. It has to be clinical rotation, preclinical, or ward round, whatever it is. Okay. All right, and then assessment task. This is the most complicated one. I think I should have a different briefing for assessment task. So we have assessment types here: clinical assignment, module, test, seminar, tutorial, preclinical, and final exam. So what does it really mean is we are going to say how many percent coming from CLO number 1, CLO number 2, number 3, 4, 5, because this is the correct way to calculate percentages allocated for the assessment based on the course learning outcome, and the weightage for it is actually based on SLT. What does it mean? If your number 1 is cognitive, right? For example, your number 1 is describe carries. Okay, describe queries. And then if I look at your course topics, okay, course topic in your SLO, in your SLT, describe queries alone comprise of 100 hours per 200. Let's say the whole course is 200 hours, but number one alone is 100 hours. So 50% of the course content coming from CLO number one. So your assessment task here should be 50% across the board, 50%. And because this is cognitive, right? This is cognitive described. So you may not have percentage in clinical. You can have in assignment, you can have in module SEM test, you can have seminar, you cannot have in preclinical projects at all because this is cognitive. But you can have in final exam. When I add up all of these, it should translate into 50% in total. Okay. And then specific tasks related to MOHI MQF LOD is learning outcome domain attribute. Attribute means what they have to know. Maybe this one I can supply another document for you to refer. It's easier that way. And then high apps. High apps is the higher higher education something. I also have that document in Google Drive. This one, if you Google high apps, HIEPS, they will have a mapping. So you just map to the course learning outcome. So psychomotor, or if it is a discussion or whatever, you can map to the high apps. Okay, so this is how to fill out the course assessment plan. Okay, and I do believe this list of PLO is actually the latest one that we have come up with in last Bengkel in Melaka. So this is the last one. I think I might get Dr. Siti Mariam to confirm later on about this PLO list. Okay, so this is the latest one. All right, I hope you understand the gist of this CAP. Now, any question? Now I'm going to open the next one, the third one, which is the local taxonomy. So this is the local taxonomy. I'm sorry about this one. If you download, this orientation will be vertical. This one will have a very long one. If you download it, it will be vertical, so it will be much better UI. Okay, so put all your CLO here, 1 to 5 or 1 to 4, and then just give one single tick to whichever relevant. If number one is C4, just tick only at C4. Okay, so this one should correlate to other document. When you put C4 here for CLO1, it should be the same for other document as well. So be careful about that. So this is quite easy for you to do. Okay, next is JSU. So for JSU, you fill out the usuals. You fill out the usual. Again, you can see the format is not very good, but if you download, I do believe it will be really good format. Okay, not like this one. Okay, and then once you fill this up, we have the general assessment framework. Okay, so we have formative, competency, continuous, and professional examination. So these two are summative. So that's why you can see 40 and 60. But if your course is 50 to 50, just change. Okay, 50 to 50. And then continuous, the number of row here designate the number of methods of assessment you are carrying out. For example, here you put semester test 1, semester test 2, semester test 3, if you have more than one. Okay, and then you have seminar, you have logbooks, you have preclinical projects. So you can list everything out here, and then you put all the percentage, which will translate into the total marks of 40%. And then for the professional examination, the same thing. You list out all your criteria, means questions, okay, the type of question, and everything will be 60%. I think this is straightforward. The next one is the details, okay. So for formative assessment, if you have, for example, some of you would have logbook as a formative assessment. So you may not feel the allocation time because logbook is actually doesn't have much time. Calculation breakdown, if you have, put it there. Result is only pass and fail, for example. And then for the summative, we have continuous assessment. You can generate as many tables as you want, based on the number of semester tests that you have. Okay, if you don't have semester tests, just change with other things that you have. Okay, so you can just give it a go for every test that you have. So I put preclinical assessment, clinical assessment here, and then you have a summary table for continuous assessment. The next one is a professional examination here. Okay, professional examination. You put the component in the paper 1, paper 2, paper 3, and then you give a calculation breakdown, calculation allocation of time for every paper, and then the final calculation. How do you get the 60% for the professional examination? Again, this one should correlate to your CAP, the percentages too. It's a bit difficult, I think, to do this because our course running throughout several semesters. If your course running in one single semesters, it's a lot easier. So life is not easy. So please do try your best. If not, do ask me. I might also need some time to understand the whole concept of it. Okay. All right. So that is for JSU. The next one, moving along, JSU blueprint number 5. If you look at here, I put 5x instead of 5. Why? Because one file will have a blueprint for every exam you have. For example, this is pertinent to your OSPE, your semester test only. Okay. For example, you have 4 semesters, 3 semesters you have semester test, and the last semester you are having professional examination. So in view of that, you would have 5A, 5B, 5C, and 5D. 5D is pro exam. 5A semester 1, semester 2, 5B semester 2, 5C semester 3. So if you have 3 semester exam, 1 pro, you would be 5A, 5B, 5C, and 5D. So this blueprint is actually will tell you what question will come out in every exam. Sorry, not what question, what topic. We only determine the topic when the topic is going to come out. So this is from UiTM. Okay, we just follow UiTM. So you have to fill up as usual. This one is already available, and also CLO. And the question type and marks also, you can have your own. I think Dr. Siti Mariam akan publish the common methods of assessment. And then you fill out the topic. So for example, semester 1, okay, in usual practice, semester 1, but it's not always like this. Semester 1, you will have like 7 topics. You can always add the row, 7 topics. You put the 7 topics, which correlates to CLO number 1. Usually in UiTM, they do that, CLO number 1 only. And then PLO 1. Time for every topic, 1, 1, 1, 1, 1, 1. And the percentages is actually easier based on the SLT. And then exam also based on the SLT, the weightage here. So you would have the exam percentages equal and weightage follows the SLT given. So when you make this up, you will understand. Okay, for now, I think it's a little bit difficult for you because it's all empty here. But once you go into it, I think we would have a different workshop for this just to fill out this one. Okay, but you can try yourself first. And as you can see here, why is it has C1, C2, C3, C4, C5, C6. It doesn't have P. It doesn't have A. Because this is actually meant for the paper base. Paper base, okay? That's why when you have OSPE instead of OSCE, OSCE is something to do with patients within the patient or anything, anything involving psychomotor. It's not listed here, but for cognitive, they put it here. Okay, it's only meant for cognitive. So you put question type OBE, SCA, MEQ, long answer question, LAQ. Okay, so that's what it is. Okay, so you just put the question and the marks, and then it will go to the total question and total marks. Okay, and the cognitive level here is being spelled out here, and C1, C2 is considered easy, C3, C4 considered medium, C5, C6 high. Literally, it means that For us, year 1 and year 2 should be around C1 to C3. For year 4 and year 5, year 4 and year 5 should be around C4, C5, C6. But when it involves patient, it should be C4 and above, because they will come up with a diagnosis, they will come up with a treatment plan. So don't put C1 or C2 for year 4 and year 5. Okay. All right. So that is about JSU. So you would have one JSU this for every test. Okay. Moving on. Kolokimohi easier. Okay, this Kolokimohi means you put all the CLO here. You are going to map your CLO if they address the learning outcome, which is kemahiran insania or soft skills. Okay, so if you have CLO1 only knowledge, you can take knowledge here. But you don't have anything here, right? There's no knowledge here. Are all soft skills. Okay, this is MOHI learning outcome. So this is the MOHI learning outcome that I mentioned to you. You can take it from LO1 to LO number 8. The CAP one. In the CAP, they have asked about MOHI, right? So you can take it from here. All right. So it has to go correlates to here too. So for example, CLO1 is describe carries. So it only take to LO1. Nothing here. But for example, CLO3 is perform. Okay, perform apa? Cavity preparation. Okay, perform cavity preparation. You map to LO2. Okay, you map to LO2 because they just perform. But there's no soft skill when involving perform cavity prep, right? So if you map to LO2 only, it shouldn't be here. It shouldn't be here. Okay, because only LO3 and above will be mapped to here. You will know what I mean later on. The next one, the next example is CLO5. CLO5 says, let me take an example of effective. For example, appraise. Let's say appraise is from effective. Okay, appraise the results, blah blah blah, and explain to the patient lah. So they need to talk to the patient, communicate to the patient. So you will put LO4, communication skills. Okay, you will put LO4, communication skills, and then it should be correlate here as S2, communication skills. So when you tick LO4, you have to tick to SS2. Okay, SS2. You might have more than one, so you can tick more than one here, but you need to be very cautious when you take more than one, or at least you take somewhere here. You have to have rubrics where you measure the communication skills. So if I were to check your document, I will find somewhere in your course you measure the communication skills that you map to CLO5. So I think if I'm not mistaken, all of you have no problem with this because you already have it. But just to make sure, on paper we have it, and practically in implementation we also have it. Just double check, okay? If you don't understand what I'm trying to say here, just ask me again later on, or you can ask now. Okay, so CLO5, you take to communication skill LO4, and also you think that you can take also on the leadership. So here you will take SS2 for communication skill, and you take SS7 for leadership. Okay, so I will try to find where you assess leadership skills in your program, in your course, in your course. So I will go to your CAP. I will look at your CLO5. Which assessment do you do for CLO5? And I go to that assessment, and I will look at your rubrics for leadership. That's how we check. Okay, that's how we check for the KI. All right, that is the Koloki Mohi. And then for the Mohi KI, this is a bit different. For Mohi KI, we have panduan untuk this. We have guideline for this. I will give you the guideline later on by UPM. UIA also have the guideline. Kemahiran komunikasi CS. So when you take to, for example, the communication skill, you take to what level? Okay. Normally, we will know this CS6, let's say CS6 level is they are able to communicate with professional manner without any guidance. So you can take CS6. So it means that you want to attain a level that our student can talk properly to our patient, professionally to our patient without us guiding them. So you put CS6. Okay, just tick at one. Okay, tick, 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 tick. That's it. And every here they have explanation. I will share the explanation to you all through your RP. Okay, that is number 7. The last one is SLT. So whatever you do here, if you got a wrong calculation here, everything else will be wrong. Assessment will be wrong because the percentage will be wrong, and then your GSU will be wrong. So everything else will be wrong. So you have to make sure your SLT is correct. So this is the new SLT template. We go by semester. Okay, we go by semester and topics. And if you can see here, we have you need to calculate all the way until whatever semester the course ends. Okay, and then at the end of the day, you need to put the exam. If you don't have professional examination or you only have final, just put final examination. Do not put the what we call this. Do not put the study time or study week, because that one already been calculated in a generic SLT for the program. Okay, so just put your professional examination. The rest you just list all the clinics, all the preclinical lab based on this one, based on SLT guideline here. But there will be a new guideline. So I think we will have that guideline shared by your RP, the new one. They have not published it yet, but we need just to use that so that we will not have double work later on. So this is the contour, the current one, but the new one have slightly different in terms of calculation. Okay, so this is how we follow to calculate your SLT. All right, so this SLT, if you look at carefully, you have to list all the topics. Okay, every single topic. Okay, so remember when I mentioned to you earlier, if you have 25 topics, so you have to have 25 topics here, all the way, and you need to divide by course. Sorry, by semester. Then we have lecture, tutorial, lab practical, clinical. Please do not change the title here, okay? Because it has to be the same across all courses in our program so that we can compare, okay? So we have face-to-face here. Sorry, these are the face-to-face. So it has to correlate to the non-face-to-face. For example, if your lecture for this one topic, for topic number 1, lecture is 1 hour. For the face-to-face, so the non-face-to-face here should be 2 hours. Tutorial, 1 hour tutorial. The non-to-face is 1 hour. Okay, so that's how it works, how the calculation. For seminar, 1 hour seminar, 2 hours. 2 hours in non-face-to-face. All right. For clinical, I think they're slightly different in the new format for the clinical. So please watch out for that new format, how to calculate the clinical. Okay. For revision here, this is not the revision in the study week. This is revision within the timetable. If you need to have some revision, you can put it here. Okay. Project report assignments, please do follow the SLT. And the formal assessment here referring to the semester exam, professional exam. Okay, you might not have in the first part of the semester. You probably have it at the end of the course or at the end of the semester. Okay, once you calculate, you will get the total. So if you are not sure how to calculate the SLT, please come to see us, any your TDA or any experts about this. Okay, just try to make sure this one is correct, then you can do everything else. So my idea is, please do the course information first, and then the second one, do the student learning time, because this one will dictate other documents. Okay, so that's the gist. I think I've done all 8 documents. Okay, any questions? Anyone? Those who are in here? Yes? Any?
Dr. Nick, all look good, macam faham. Basically reputation je benda-bendanya, cuma nak calculate the percentage yang dalam CAP tu, kalau untuk DFM, DFO agak susah sikit sebab banyak topik dan percentage distribution tu.
Yes, yes, I do understand, but good luck for that. You can calculate, you can try your best. Any more question? Yes?
Dr. Nick,
Yeah.
this one terguna pakai untuk for PG program also kan? I mean
You can use for PG
the
program.
template, the template that you
Yes,
prepare ni sama je kan?
sama je.
Okay.
You can use.
Okay, thanks.
You're welcome. Anyone else?
Dr. Nick,
Yeah.
for the Assalamualaikum.
Waalaikumsalam.
For the SLT, do we need to calculate the duration, the time for the examination for our pro exam?
Yes, yes. So basically,
This is part of the.
Yeah.
So that
You need to
that's
have
me.
your SLT done first. You need to have your SLT done first, and then you will know how much your exam will worth, because the percentage, remember the 50% I calculated earlier, CLO1 is 50%, so where the 50% coming from, so the weightage. So calculate the SLT first, then only you know how much time that you need to spend for exam, you know. It's not something that is very strict. You just try to propose how much exam going to be worth. So for example, your cognitive will be 15%, 25% your psychomotor, and then the rest probably effective, or probably CLO number 3, CLO number 4, you know, something like that. It's a bit difficult, I do understand that, but try your best.
Okay, thank you.
Welcome. Any more question? Okay, if there's no question.
Dr. Nick.
Yeah.
Yeah, just a question, Zihad here. Just a question about the assessment. Let's say in the do we have like certain guideline, because last time during the assessment, for example MEQ, we put like macam the MEQ marks, full marks 100. Is it any change in terms of SLT calculation?
Okay,
Because some of the university also they cakap kalau SLT macam gini, so exam should be berapa jam macam tu.
Yes, correct. That's what I try to say, the percentage based on the weightage, Jan. But I think academic unit will issue MEQ. We will try to make it uniform throughout the courses. For example, as you mentioned, NEQ, modified essay question, maybe they will say it should be 100 marks, and that 100 marks should correlate to 40 minutes, for example. So when academic unit publish that guideline, so everyone can follow that. So maksudnya for MEQ, you will have 40 minutes for one question and 100 marks. So everybody maybe need to follow that method of assessment if you need one. Okay, so I think academic unit will give us the guideline of what type of method, how many hours, or sorry, how many minutes it worth, and also the marks. Okay, maybe we have to have a workshop, Zihan, for the new one, because we need to calculate how much your exam would need to have based on the weightage of SLT tu lah, by topics.
Yes, because some of the external examiner also last time they mentioned 100 marks for MEQ is quite high, and satu point je 5 markah, dia kata not fair as well.
That's correct. Yeah, betul. Okay, any more question? Okay, if that's it, thank you very much everyone for listening, and I will share the recording so that you can share with others who are not here today. Okay, thank you very much. Assalamualaikum.
Waalaikumsalam. Thank you so much.
Thank you, Dr. Nick.
Welcome.
Terima kasih.